Well, the Affordable Health Care Act continues to be in grave trouble. A new report shows that somewhere between 8% and 20% of the eligible 20 to 40-year-olds have not yet enrolled, with only weeks left for enrollment. And many are opting out to just take the $95 penalty instead of the $1,200 fee for insurance. And the 92 million people who are eligible to work by age and skills, 92 million, that's about a third of the American population. But when you take out seniors who are retired and kids under the age of 16, you're looking at maybe, instead of 30%, you're looking at somewhere between 40 and 50% of the eligible workers are not working. They're on unemployment, they're on disability, they're on welfare. Many are collecting all three, so they're kind of in fat city, and they're not interested in getting a job because they make more money not working than they do working. So what I want you to do is realize that right now it's an ill wind that blows no man goodwill, okay? And so basically what's happening here, we are getting bombarded by people who can't afford health care. They're losing their insurance. They're losing their jobs. They don't want insurance because they don't want to go to doctors because they've sort of investigated now. They're getting their three opinions instead of just taking their doctor's advice. They're saying, wait a minute, I can actually support rebuilding the cartilage in my hip for $1,500 over a 3-month period as opposed to $78,000 for getting it replaced. And I have to pay for this out of my own pocket. I want to do the $1,500 thing with the Healthy Bone and Joint Pack. Well, I want you to get a hold of that trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport to Aromatherapy, and learn how to deal with over 900 different diseases using vitamins, minerals, and trace minerals, and rare earths, amino acids, fatty acids, herbs, and aromatherapy oils. That's a trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport to Aromatherapy. Then when you're looking for longevity, say, gosh, everybody in my family died in their 30s and 40s. I'd like to live longer than that. What do I do? What do I do? Do I get vaccinations? Do I see a doctor? No. Contact your Youngevity associate and get a hold of the book Immortality and learn how the top 20 longevity cultures have 40 times 100-year-olds we do. How, these people are illiterate. They don't have doctors and clinics and hospitals, no insurance, and yet they have 100-year-old per 250 of their population. We have 100-year-old per 10,000. We spend more money for health care than everybody else. What's their secrets? Well, get a hold of that book, Immortality. And then coming out in the next couple of months, we're talking very quick here now. I'm getting the final edits now. It's going to publication in a week. We're talking about the book Epigenetics. The subtitle is The Death of the Genetic Theory of Disease Transmission, and how all the diseases the doctors told you were genetic, like cancer, diabetes, Alzheimer's disease, has been an absolute fraud. And that cholesterol causes heart disease and stroke, an absolute fraud. All the evidence of this is in this new book coming out, Epigenetics, The Death of the Genetic Theory of Disease Transmission. This is going to be a killer book. Let me tell you, the graveyards are full of failed medical theories, right? Evil spirits, little gods on planets, spontaneous generation, prions causing things like mad cow disease and Creutzfeldt-Jakob disease, right? All those things are absolutely fraud. Cholesterol does not cause heart attacks. Cholesterol does not cause stroke. Cholesterol is a good thing. And because doctors got you off of cholesterol and gave you cholesterol-lowering medications, they are the authors of Alzheimer's disease. Alzheimer's disease is, in fact, a physician-caused disease. All the evidence of this and how to unravel all the things that the doctors have inflicted upon you are in the book Epigenetics, coming out here soon. So contact your Youngevity associate. Don't wait in line. Get your order in now for Epigenetics. And what you want to do is say, look, I want to help myself. I want to help my family. How do I get my stuff for free? Ask them how you can get your Youngevity products for free, how you can get your Healthy Start Packs for free, how you can get your Healthy Bone and Joint Packs for free, how you can get your Healthy Heart and Brain Packs for free, how you can get your Healthy Digestion Packs for free. You can get it all for free. That's right. We will show you how to do that. And, of course, you can be a preferred customer. You don't need to even pay your $10 one-time fee if you don't want to do that. You can, for free, we'll show you how to get your products at a 30% discount. You don't even have to pay shipping. That's usually the big price of these TV infomercials. All you have to do is pay shipping and handling, which is, like $200. Well, we'll pay the shipping and handling if you just go to an auto ship. And you can get a 30% discount, right? You're going to pay what doctors pay for these products. You're going to pay what health food stores pay for these products. Okay? You're not going to pay retail. and you don't even have to pay shipping and handling. All you have to do is step up to the plate, and we'll help you do it. It's very, very simple. We're going to add 25 to 50 healthy years to your life. We'll show you how to do that. We will show you how to avoid going to the doctors. Why would you let doctors inflict pain on you, give you prescriptions that can kill you? Why would you let doctors operate on you and give you infections? I mean, according to the Center for Disease Control and the Journal of the American Medical Association 2007, is that medical doctors inflict 15 million deaths, injuries, and infections upon their customers in their workplace each year. 15 million deaths, infections, and injuries on their customers in their workplace every year. No other industry would survive that. Why do you keep going to doctors? Contact your Youngevity associate today and save yourself, and better yet, save your kids and your grandkids. Well, we'll be back with more Truth, Justice, and the Youngevity Way on Dead Doctors Don't Lie after these messages. Okay, Doug, what pearls of wisdom do you have for us?
Well, it's interesting that you were talking about longevity in your monologue, as I've got a story here from Fox News that is from a gentleman who's a doctor and a professor of medicine and engineering at the University of Southern California. Well, he has written a book that he contends is a guideline for longevity. And I think you might take exception to most of everything that he recommends here. This news story is actually headlined, Do's and Don'ts for Longer Life. They say 1 minute they tell you coffee's good for you, then it's bad. They're told wine will make you live longer, then they say it won't. And he poses the question, wouldn't it be nice to have a guideline to longevity that is easy to understand? And I thought, well, I've already got that in my library. That's the Immortality book written by you and Dr. Milan. And this is a Dr. David Angus. And I'm not going to say the name of his book because we don't want anyone to go out and buy the thing because it's just chock full of bad advice. In fact, I think we need to come up with a Dunderhead Doctor Award, and we'll give it, the first one that we hand out will be to this guy. He's divided his book into 3 sections called What to Do, What to Avoid, and Doctor's Orders. It's a do's and don'ts list, and it says surprising advice such as staying away from juicing. I guess he's never heard of Jay Cornish and how that helped him live an additional, 40, 50 years.
Exactly.
He says, as soon as you put fruits and vegetables in the blender, they oxidize and degrade almost instantaneously. He recommends eating real food, but doesn't specify what that is. Also advises people to have a significant other and live with that person, have children, caffeinate in moderation, and do DNA testing. I don't know how doing DNA testing is going to help you live any longer. It might let you know if your offspring are going to live longer if you've got some congenital disease of some sort.
Well, that's falling into disrepute now, too.
Oh, that's true. That is true.
We'll talk about that tomorrow.
Yeah, and that what he does also tells people to avoid is wearing stiletto heels and detoxing and taking vitamins. And I think that the avoiding stiletto heels is about the only one we can agree with.
Yeah, I'd agree with that. I don't think I'm going to wear stiletto heels.
Me neither. I got rid of mine a long time ago. But I just thought it's just crazy. I wanted to mention this because we don't want anyone to buy into this guy's just load of hogwash and stop taking vitamins because some idiot doctor from Southern California says you should.
Yeah, well, thank you, Doug, for bringing this one up to the surface. But it just shows how shallow these guys are in the medical system, how terribly they have failed the American public for all the money they're getting. This guy's got at least 3 degrees. He's an engineer. He's a physician. He had to have his pre-med degree. This guy has at least 3 university degrees, and he's showing, the IQ of like 65 here. This is just absolutely terrible stuff. And, we need to have something that's, like the music from the Phantom of the Opera, something really...
maybe the
Devil
theme
Wears
from
Prada.
Star Wars when the Empire is coming in.
Darth Vader.
Yeah, there you go. The music that they always play when Darth Vader enters the room.
Yeah, exactly. And so that would be great for these kind of guys because, these are the kind of guys you want to stay away from. And, of course, you have to educate yourself. And, of course, these are the sort of guys the Chinese have figured out how to solve the problem. And I don't encourage people to do the Chinese method for dealing with dunderhead doctors. If they have a doctor who injures their parents or their spouses or their kids or their brothers and sisters, they get all the villagers to go in with their hose and rakes and beat the doctor to death with all their implements and tools. And last year in China, in the Western-style hospitals, in each hospital, in each of the, on the average, there's 27.3 doctors. I don't know how to get the 0.3, but 27.3 doctors are killed by the families of patients who are killed by the doctor in the Western-style hospitals in China. Well, I don't think we should do that, but I think what we should do is learn how to stay away from them, let them die on the vine from not having any customers, like the old Maytag washer and dryer repairmen used to do. Well, thank you so much, Doug, for that one. I can't wait for the Darth Vader music. Well, we'll be back with more Dead Doctors Don't Lie after these messages. Okay, Doug, let's go to callers.
Let's head to Florida. And Andrew, you're on with Dr. Wallach.
Hello, Andrew, you're on the air.
Hi, Dr. Wallach.
Yes, sir. How can I help you?
Well, I have diabetes. I've had that for about 10 years.
Okay, now is this type 1 or type 2?
Type 2, but I haven't been to a doctor in a while, so I don't know if it could change to type 1.
No, it wouldn't change to type 1. But
okay.
But are you on insulin injections? Or are you taking pills? Or are you trying to control it with diet?
Honest confession, I haven't done anything. I've tried to keep my diet pretty good, but I'm poor in doing that, doctor.
Okay, what is your well, tell me what your fasting blood sugar is in the morning. Do you know what your blood sugar is in the morning?
No, I don't. I can tell you that my blood sugar was in the range of 200 to 300.
Okay. How much do you weigh, sir?
I weigh 153 pounds, and I'm 5'6".
Okay. Do you have any other issues like arthritis or back problems or anything?
I do. I have, the last year, I had some eye issues where right before I wake up, my eyes would be pain in my eyes, like a pressure, and I don't know what that is. I haven't gone to the doctor, but I'm sure it's not good. I have circulation issues where I know that there's sounds like I have some heart disease going on because I've got a little bit
if you have high blood pressure?
I don't have high blood pressure. I know I have bad LDL, and my wife, as they say, there's a side effect of diabetes with circulation, and not to get into detail.
Okay, we're talking about you right now. Okay, wait a minute, we're talking about you right now. Right?
What I'm saying is that this the circulation issues is affecting me, and I have joint pain in my fingers. You do have
some joint problems. Okay, so let me just repeat that here. Shar, I want you to listen to this. Okay, here's a 153-pound guy. His blood sugar ranges 200 to 300 in the morning. He has some maybe blood pressure issues. His blood sugar is really out of control, 200 to 300 in the morning. He's got some joint issues. And so what would you do for this guy? Well, hang on. We got to run to that. Wait a minute. We got to run to this message moment. I apologize. So we come back. Get your pencil and paper ready, Andrew, because between Shar and I, we're going to give you what you need for all of your problems here. We'll be back after these messages. Okay, Doug, let's go right back to Florida and Andrew. Okay, Shar, again, here's this guy, 153 pounds, blood sugar 200 to 300, type 2 diabetes, has joint problems, has some blood pressure issues maybe, and he does have eye pressure. I think that's where the blood pressure thing comes in. He may have some glaucoma, something like that. Now, what would you do for this guy?
Well, first I'd get him on a gluten-free diet, and he needs the healthy. I would give him the healthy blood sugar 2.0 pack, but he also needs he needs some Ultimate Daily for circulation, and he needs some glucogel for arthritis and everything.
Yeah, very good, excellent. Okay, perfect. Oh, so what I would do exactly as you say, Shar, give you an A+ on that one. This fella Andrew should be getting on a gluten-free diet, absolutely drop-dead gluten-free. Everybody in his household has got to be gluten-free, no fried foods, no processed meats, no oils. Got to get rid of the glutens. All the things are inflammatory, which cause obstruction of arteries, that damages cell walls and encourages diabetes and all this kind of stuff. No sugar because he's diabetic. That means no fruit juices, no dried fruit, no fresh fruit, no molasses, no honey, no agave syrup, nothing that's made from sugar, natural or processed. And then, again, as you say, even if he's a little heavy-handed, but he's got so many things going on here, starting to get all kinds of problems, so I would throw in 2 healthy blood sugar packs. That'll be 1 ounce of the Osteo FX Plus at breakfast and dinner, 2 scoops of the Beyond Tangerine NutriCrystals 2.0 at breakfast and dinner. Also, it would give him 3 of the EFA Pluses at breakfast and dinner. And then for the pressure in his eye and blood pressure problems and so forth, blood vessel problems, I would give him 3 of the Ultimate Dailies twice a day, 3 at breakfast, 3 at dinner. That's 1 bottle a month. And then the Glucogel, I'd get him 2 large bottles of Glucogel, so he could have 15 a day, 5 at breakfast, 5 at lunch, 5 at dinner. That is for the supporting maintenance repair of the joints, cartilage, ligaments, tendons, connective tissue. And as part of those 2 healthy blood sugar packs, in each one of them, he's going to get a bottle of Sweet Ease, and he should be taking 3 Sweet Ease twice a day. And then, of course, he needs to be taking his fasting blood sugar so he knows what's going on here. And he needs to test himself every day. Make sure this blood sugar is coming down. If it's not, he needs to go to a doctor and get evaluated here. But I would certainly, if his blood sugar is coming down, his joint pain is going away, blood pressure is going down, wouldn't hurt to go to an eye doctor. An eye doctor is non-invasive, very economical. They tend not to kill people. So it wouldn't hurt if he's got pressure in his eye, just want to get some drops from the eye doctor in case it is glaucoma. That way he can reduce the pressure in that eye immediately and save his vision. And so you're exactly right, Char. That's exactly what I would do for this guy. And Andrew, you need to call us every couple of weeks. Let us know what your eye doctor says. Let us know what your blood pressure is. Let us know what your blood sugar is. Let us know what your weight is. And we'll walk you through this. But do see an eye doctor just in case you do have glaucoma. We want you to save your vision. We'll be back after these messages.
Let's head to Virginia. And Carmen, you're on with Dr. Wallach.
Oh, Carmen, you're on the air.
Hi, Dr. Wallach. I was calling for my nephew and my mom, who's been on CTT and stuff since the 19th of December. She has gone into the hospital 6 times in the last 2 weeks because her sodium is too low. It's like 25. So they told her to take sodium tablet 1 gram 3 times a day, which I think that's high. And her blood pressure is coming down. It's from 190 down to 151/90, which is high, but it's low for her. But they've got her on 3 medications instead of 5, and then on medication it's down to 138/60, which is still a little high.
Did they give her any supplemental sodium, like Slow K or anything like that?
They've got her on salt tablets.
Oh, they got her on salt tablets.
Yeah.
Okay. Now, did they say anything about her adrenal glands?
No.
Okay. Usually when people have a dropped sodium, they have adrenal failure, okay? Maybe adrenal cortical failure, Addison's disease. And so they might want to be thinking about that. And so anytime somebody is being given salt tablets and so forth by a doctor, you know, they're really confused. And so what I would do, what does your mom weigh?
She's down to 189 since she's been on BTT and stuff. She was over 200, and she's 5 feet tall.
Okay. Now, does she have any any skin issues?
No, she has cataracts and glaucoma. I mean, macular degeneration, and she gets vertigo, but she doesn't have any skin issues.
Okay. Did she ever have any respiratory stuff?
She used to get bronchitis as a child, and she had her appendix out when she was 16, I think.
There we go. There's what we're looking for. Okay. Char, what do we got going here?
Gluten intolerance, and this is what is causing all the other extra problems.
Exactly. She cannot even absorb salt. Yep. Her problem is so egregious.
That's really bad.
And you're her daughter, right?
Yes.
Okay. Now, do you have any history of skin problems or asthma or bronchitis?
Bronchitis every time the seasons changed until 1981.
Yeah, you need to get on a gluten-free diet also, and your children need to get on a gluten-free diet. Your siblings, your brothers and sisters need to get on a gluten-free diet, and your sister's kids need to get on a gluten-free diet. Your mom and her siblings need to get on a gluten-free diet. And as Char says, and anytime you have an appendicitis, any bowel problems, chronic bronchitis or asthma, this is definitely a gluten problem here. And your mom at 189 pounds, with all this going on here, I would definitely give her 2 of the Healthy Heart and Brain packs per month. That way she'd be getting 3 of our Ultimate Seleniums at breakfast and dinner, 1 ounce of the OsteoFX Plus at breakfast and dinner, 2 scoops of the Beyond Tangerine 2.0. I'd go with the 2.0 at breakfast and dinner, and also 3 of the EFA Pluses at breakfast and dinner, and 3 of the EFAs at breakfast and dinner. And then I would, let's see here, I would also throw in, what else did we have? Oh, her vertigo. I would also throw in 2 of the large bottles of glucogel, have her take 15 glucogel a day, 5 at breakfast, lunch, and dinner. Get her the couple of jars of the CM cream, and she can take a quarter of a teaspoon or half a teaspoon twice a day in each ear. Have her use a Q-tip like she's trying to get wax out of her ear, get that CM cream down in her ear. And let's go there. If she wants to lose weight faster, she can also throw in the ASAP, put a dropper full under her tongue 30 minutes before each meal, 1 bottle a month, or do her that. And then, of course, the salt. What I'd have her do all day is sipping on our Rebound sports drink. Okay, it does have the electrolytes in it, including sodium, potassium, chloride, and she should salt her food to taste. But the de-stress capsules, 3 of those twice a day, 2 bottles a month, is going to give her adrenal substance, which is going to help her, because whenever somebody is either losing sodium like that, she could have, it's kind of like she'd be getting a positive sweat test. It'd be very interesting for her to get a sweat test. Next time you see the doctor, say, would you give my mom a sweat test and see if she's positive for a sweat test? Because you see this with like 17 different diseases, including gluten intolerance and so forth. So that would be very interesting for a lady her age. But anyway, call us every couple of weeks. Let us know what's going on.
And my nephew also has some problems.
Okay.
He's he has.
Now, is he your mother's? Wait a minute. Is your nephew your mom's grandchild on her side, or is it the nephew is from the father's side?
Her other daughter's son. Her other daughter's.
Okay, well that's fine. Okay.
He's also, I'm sure, gluten intolerant because his hair is thin like hers, and he doesn't know what's wrong. He keeps coughing if he talks. If he doesn't talk, he doesn't cough.
How old is he?
A lot of congestion. He'll be 40 next year. He's 39.
40. Yeah. Does he have any skin problems?
No, but he had his intestines, half of them taken out when he was 11.
Why is that?
I don't know.
Did he have Crohn's disease or irritable bowel syndrome, or?
I guess irritable. So I guess that.
IBS, something like that.
Yes, and
he's got gluten intolerance too, and the doctors should all be put in jail for taking half of his intestines out. You got to be kidding me. So, just like we've said on your mom, your nephew, 40 years old, he needs to be on a gluten-free diet, no fried foods, no processed meats, just like your mom, his grandmom. And he needs to get on, what does he weigh?
He weighs 235, and he's 5'11".
Okay, Charlotte, would you give him 235?
He needs 2, and I'd probably give him the healthy bone and joint pack,
okay,
and also he really, what was I was going to say? I can't. I just lost my train of thought. But
okay, well let's just go 2 healthy bone and joint packs. That'll be 1 ounce of the OsteoFX Plus at breakfast and dinner, 2 scoops of the Beyond Tangerine 2.0 at breakfast and dinner, 3 of the EFA Pluses at breakfast and dinner, and then that would also give him 2 large bottles of glucogel, so he could take 15 a day, 5 at breakfast, lunch, and dinner. And then I would throw in 2 bottles of selenium, 3 at breakfast, 3 at dinner, because anytime, you get half your intestines taken out, that kind of stuff, we're talking about he's got some major free radical damage going on in his body, and he's going to need the help of that selenium to support and promote recycling of glutathione and all that kind of stuff that selenium does. Anti-inflammatory, reduce oxidation, reduce free radical damage. So I'd give him at least 3 selenium twice a day, maybe even better, 9 a day, 3 at breakfast, lunch, and dinner. It'd be 3 bottles a month of selenium. And then call us. But these doctors have missed this very badly. I just don't understand how they miss it so badly when the symptoms are so egregiously obvious. But thank you for sharing these cases. Call us every couple of weeks. Give us an update. Call us anytime if there's more questions. Okay, Doug, let's go to a caller.
Oh, we're just about at break time.
Okay, well, I'm going to go ahead and take it. We're just about at break time. And remind everybody, get a hold of that book, Immortality, and learn how to add 25 to 50 healthy years to your life. Immortality, the book. Don't forget, From Here to Immortality, the CD. Don't forget, What Kills Billionaires, the CD. And Dial MD for Murder, the MD, right, the CD. And you're going to learn how to add 25 to 50 healthy years to your life, and better yet, 25 to 50 healthy years to your kids and your grandkids' life. Well, stick with us. We'll be back with more Truth, Justice, and the Longevity Way on Dead Doctors Don't Lie for these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity and 90 for Life Crusade. Doug, let's go to callers.
Let's head to Georgia. And Rita, you're on with Dr. Wallach.
Hello, Rita. You're on the air.
Hi, Dr. Wallach. My question was, how would I detox the brain, my body, and my organs from being exposed to harmful chemicals in the air? Like, I'm hypersensitive. I have multi-chemical sensitivity. When people are smoking marijuana or whatever else they're making, whether it's meth or
you
something.
need to find a different crowd to hang out with.
Well, no, I don't hang out with them, sir. It's just I'm hypersensitive. I have medical documentation from Washington State, but the doctors here in Georgia have not helped me. I've only had one doctor tell me his office staff stated that I have all the symptoms of someone who's been exposed to a chemical lab, but they would not put it in writing so that I could get the proper help that I needed. So
okay. So let's start out. How much do you weigh?
About 155, 165.
Okay, and how tall are you?
5 feet, 1 1/4.
Okay. Then, do you have any other issues? Any eczema, dermatitis, psoriasis, or rosacea?
My skin is severely dry. I have burning sensations to my face, and it when those vapors are coming in here, it makes my head hurt so bad that I give off a foul odor. It makes my foot like it's burning, and that's not normal.
Okay, now tell me, let's just we only got a moment here, dear. I need to know a couple more things. Do you have any history of bowel problems, any constipation or diarrhea?
No, I go to the bathroom quite frequent.
Okay. Any history of asthma or bronchitis as a kid?
No, sir.
Okay. Do you have any children with those problems?
No, sir.
Okay. All right. Well, basically, what I would do is do something very, very conservative to begin with. Number one, and you've probably done a lot of this, is I would get rid of all the bad stuff out of your life, all the inflammatory stuff. Take the load off your immune system. No fried foods. No exceptions. No processed meats with nitrates and nitrites. No exceptions. Absolutely no deli slices, no sandwich meats, no oils, no margarines, mayonnaise, salad dressings, cooking oils. If you eat canned fish, you got to be packed in water, mustard, tomato sauce, not oil. No gluten, no wheat, barley, rye, or oats. No wheat, barley, rye, or oats. And then, because you have a severe skin problem or dry problem, I would go ahead and do something really simple here. I'd start out with one of the Healthy Start packs per month. Just take one. Take a half a dose of everything at breakfast, half a dose of everything at dinner. It'd be a tablespoon of the OsteoFX Plus at breakfast and dinner, 1 scoop of the BTT, Beyond Tangerine 2.0 at breakfast, 1 scoop at dinner. The 3 EFA Pluses, I'd have you take 1 at breakfast, 1 at lunch, 1 at dinner. And if you go for a week and there's no problems, then I'd go ahead and order a second one the next go-around. So you're going to have 2. You'll have, I want you to have 2 per month, but let's try and get through 1 a month here for the first month without having any kind of reactions and so forth. The goal here is for you to be taking a full dose of each of those products of the Healthy Start pack at breakfast and dinner. That would require 2 of the Healthy Start packs per month, and stay away from all the bad stuff. And let's see if we can do some basic things here. Oftentimes, something obscure like this, nobody can help you. They can't figure it out. They do a lot of tests. But you have some of the symptoms here. You got the dry skin, okay? You got the neuropathies. You got the tingling or the sensations going on. And these can be the result of something like peripheral neuropathies from degenerative disc disease. They could be the beginnings of something like MS, multiple sclerosis. I don't know if did they do a CAT scan of your head?
Yes, I've had that. I've even had a spinal tap in Washington State. So,
Okay, and they never found any MS.
no, sir.
Okay, good. That's very good. All right, well, at least they looked there. Okay, good. So that helps us just get down to the high possibility that there's a basic gluten intolerance. So let's go there. Call us every week. Don't wait 2 weeks. Call us every week. You're welcome to call more often and give us an update. Ask any questions you want. We'll walk you through this, Rita. Okay, well, thank you, everybody. Really great questions and testimonies today. Thank you so much, Shar. Thank you so much, Doug and Richard. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.